I'm Asian, female, with an inner double fold eyelid. How much would it cost to fix? I want to know the cost and the recovery time. And I want natural.
Thank you for your question. You've submitted two photos, close-ups of your eyes, one eye's open and one eye's closed. And your question is you have double creases and you want it fixed. And you don't describe much more beyond that. So I'm going to try to figure out what exactly you're concerned about based on the photos you submitted and what I suspect is your concern. I'm a cosmetic oculofacial plastic surgeon specializing in surgeries such as Asian eyelid surgery for over 20 years in Manhattan and in Long Island. And what I believe you're describing when I look at your photos are these fine little creases, and it looks like there's several little creases that are not well defined, and I suspect that that's what's concerning you. Well, to understand what those creases represent has to do with the anatomy of your eyelids. And a lot of times those fine little creases can simply be folds that occur from natural opening and closing of the eyes. And in addition to that, those creases can also represent partial connection between the eyelid skin and a muscle called the levator muscle. The muscle called the levator muscle is like the word elevator. It's the muscle that lifts your eyelid. And with Asians who don't have a crease, there's no strong connection between the muscle and the skin. And one of the key foundation of Asian eyelid surgery is to create that connection. In my practice, when patients like yourself have come, we've always tried to figure out first, is there any desire to have a crease? If based on your question, your concern is not only the multiple folds and you'd like to define it as a single fold, well then in Asian eyelid surgery, whether it's a incisional where we remove skin and work on fat is one option, or a non-incisional where skin is folded in to create a crease. But if you have no desire to create a fold or a double fold or a crease, there are these different terms used for the same end result, then it's not that practical to try to address those micro little fine creases that you see. If you have an interest in creating a fold or a crease, then you have options. Looking at those photos, I think that most likely you're young, that you don't appear to have extra fat or extra skin. Now that determination does require physical examination, but in most cases of very young people who come who don't have extra fat getting in the way, and that's a very important distinction in planning eyelid surgery, then a non-incisional Asian eyelid procedure is performed. What a non-incisional procedure is, the terminology is a little bit unclear because you are making little openings, and those are incisions. But what you're not making is a long incision to remove skin. What we're doing is we're using sutures to connect the muscle that lifts the eyelid, the levator muscle, with the skin to create this infolding. And in deciding whether or not to do a nasally tapered fold, one that flows into the epicanthal fold, or a parallel crease, one that flows a little bit past the epicanthal fold, that's a personal choice and decision. The way I usually make that determination is by using either a Q-tip or a little eyelid creasing instrument that we use to push the skin in and to see what nature would have created and see if the patient likes that. And if that's what works, then we can figure out the appropriate procedure for the individual patient. So again, to summarize, if your main concern are those fine little tiny folds, I don't think there's a practical way to approach them without doing something that's disruptive and won't really yield a good result. But if you're looking to create a single crease that creates a double eyelid appearance, then you do have options. And to understand which options are right for you, you're going to need to meet with qualified, experienced cosmetic surgeons who specialize in Asian eyelid surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.